Hi everyone, welcome back to the Nico the Vet channel. For today's talk, I thought what we might do is look a little bit at coughing and wheezing in cats particularly. So this is not interchangeable between cats and dogs. This is specifically for cats. Coughing and wheezing, so common symptom in you, me, the cat and the dog. But in cats, the list of explanations is quite different to the list that you would presume would be applicable to yourself and extrapolate onto the cat. So quickly an overview of the anatomy, just to state the blatantly obvious. The respiratory system consists of the nose. You've got to have air in through the nose. It goes down through the back of the throat, through the voice box, down through the windpipe or the trachea, which then splits into a left and a right bronchus, which is the trachea splitting into two smaller tubes, and then you're obviously into the left and the right lung, and then once it's in the lungs, the bronchus splits more and more and more again, almost like a tree branches splitting out into the bronchioles. The bronchioles are the finest airway tubes in the lungs, and they terminate in the alveoli, which are almost like little bags at the end. So imagine you get the air tube sort of coming in there, it goes to there, and there's a bag at the end, and that's where where the oxygen goes from the airway into the blood, and the carbon dioxide comes back and you breathe it out. So if you are coughing and wheezing in human beings and in dogs, you could have a tickly cough. Often describe it so there's something irritating in your throat or your windpipe, and that produces that sort of tickly cough. Whereas as opposed to that sort of moist, that chesty cough, which oftentimes comes from the lungs. And in cats, first of all, coughing is rare in cats, nowhere near as common as it is in human beings, and wheezing is probably the more dominant symptom. So when I use wheezing, I'm often using coughing at the same time, and wheezing is not like a nose thing, it's an outward problem. It's a that sort of sound and that sort of movement. And typically when cats do wheeze and cough, they do a very specific sort of body posturing when they do it, which is to say the head goes sort of down, the neck gets extended, they drop their shoulders, so the elbows will sometimes come out, and you get this sort of movement with them, which carries on just for a few moments. So it's rarely a sort of a barking cough like you and I and the dog might get. So when you get this sound coming out, what it tells us is that the cat has to put more effort into getting air out of the lungs than in the lungs. So there's no alteration in the sound or in the mechanism of getting the air in. So the lungs inflate, you do the oxygen exchange, but then to get it out, that sort of wheeze. So really, four common things are going to cause this. It's a much shorter list than it is in human beings and dogs again. And the things one would consider when you see your cat doing this would be bronchitis, asthma, lungworm, and infections. So let's deal with it in that order. When you and I get a cough, the vast majority of cases we've got an infection. It's either in the windpipe, the upper airway, or in the lower airway, which is in the lungs. In cats, infections per se, meaning an infection without anything else going on, they were just unfortunate and got a chest infection, are quite uncommon. They're quite it's not something we'd often see. So it's the opposite of in people. In people, that's what it's going to be 9 times out of 10. In cats, that's probably the least common. If it is that, then you've got to consider, is it viral or bacterial? If it's viral, you have to just wait for it to pass, which will take a week or two. And if it's bacterial, of course, we can help with antibiotics. But that's altogether the least common. Probably the second least common cause is lungworm, which is exactly what it says. It's a worm that cats can get that spends some of the life cycle in the lungs, and obviously with these worms in your lower airways, that it causes irritation in the airways, and just like anything irritating, if I sort of irritate my finger by rubbing it like that, it goes red and inflamed, and that's again what triggers the cough and the wheeze. It obviously would take the appropriate tests to diagnose it, and the treatment would be a worming treatment, which would be appropriate to kill lungworms specifically in cats. Usually we use fenbendazole, which is traded most commonly as Panica. Relatively easy to resolve. The first two, so infections and lungworm, are almost, although they're the rarest and by a long shot, the less common, they are the more desirable in the sense that you can treat that, you can fix it, and it's gone forever. Unfortunately, the more common two reasons for coughing and wheezing in cats are going to be bronchitis and asthma. So if we go back to my initial explanation of the airways, where you have the trachea coming down, splitting into a left and a right bronchus, which then goes into the bronchioles. And when we say you've got bronchitis, what in the medical world, any word ending in itis means inflammation, and the first part of the word tells you what inflamed. So for example, if I had appendicitis, there's itis, inflammation of my appendix. And so if you break down bronchitis, it just means inflammation of the bronchi. Now, patently, you have to consider what's causing that inflammation. Again, the possibility is you could have lungworm causing the irritation, you could have bacterial viral infection causing the irritation, but the vast majority of cases are inflammation in the airway in the absence of infection, which is similar to asthma but not quite the same. So in bronchitis, in horses you probably call that broken-winded, and in people you might talk about COPD or and it's what leads to end-stage emphysema. But the characteristic of that condition is it causes inflammation in the airways, whereas in asthma, just to split hairs a little bit, asthma causes inflammation in the airways and spasm of the airways. So what is the implication of that? So when the airway is inflamed, imagine that's an airway, the inflammation of the lining of the airway swells inwards, so the airway narrows, which doesn't help your breathing, and then because the airway is inflamed, it produces more secretion. So basically mucus is being produced. So you get a narrowed airway with now thick gloppy mucus forming in there, and now you're trying to breathe through the narrowed airway and past the glop of mucus, and that produces that sort of wheeze sound, and the cough is your body trying to expectorate that, trying to get rid of it. So in your classic bronchitis, all one would need to do is give an anti-inflammatory, and really steroids are the most appropriate anti-inflammatory to bring down inflammation in the airway. All the other anti-inflammatory drugs are significantly less effective, whereas if you were treating asthma, you want to do two things. You want to bring down the inflammation, because that stops the narrowing and it stops the increased mucus production. But you also want to stop the spasm of the airway, because then on top of that narrowing and the muck in the airway, it then spasms, and then you've really got no patency to breathe through. So how do we diagnose these conditions? Although they're the most common of the four, they are the more tricky ones to diagnose. Very oftentimes you can do an investigation into it. So you do blood tests and you do x-rays and lung flushes, and you can get almost nothing back. So you get completely non-specific results back. The x-rays say you're fine, the blood tests say you're fine, and the a lung flush, basically what we do is under anesthesia, we squirt a little bit of saline into the lungs, and then think about sort of percussing the lungs, and then you suck that bit of fluid back and it'll bring back some of the mucus. And we can look in that mucus for, are there just inflammatory cells, which you'd see with bronchitis? Are there allergic inflammatory cells, which we'd see with asthma? Or is there evidence of infection like bacteria or the lungworm in there? So the most common, to my mind, condition that will cause chronic, and when we say chronic, we mean long-term coughing and wheezing in cats, is going to be asthma, and they sort of dolly it up a little bit and call it feline bronchial asthma. I think it was first described in the 1800s and in cats, and frustratingly, I don't think our knowledge has progressed significantly from that point of view, in the sense that we know it's an allergic reaction, we know it's an allergic reaction to environmental agents, but why does cat A react and cat B not react, just like in human beings? Why is Fred got asthma and Betty doesn't? First of all, why is that going on? We don't understand that, because if we understood that, why is one individual allergic and one not, we'd be much better at addressing the problem. So we're really not aiming at cure with the bronchitis and the asthma patients like we are with the lungworm and the infections. We're not aiming at cure, we're aiming at management and control. So the idea is to make the situation as much better as possible without unfortunately curing it once and for all and having it go away. And of course, just like in human beings, if you look at people with chronic bronchitis, just to digress a little bit there, when in the medical world, when we talk about acute versus chronic, acute means it's a relatively new onset of symptoms and it's been going on for less than 3 weeks. Whereas chronic means it's been going on for a long time, 3 weeks. Sometimes I even get cats coming to me with a history of it's been going on for years, on and off, the coughing and the wheezing. And then, of course, the criteria is if it's been going on for more than 3 weeks, we call it chronic. So people sometimes use the word chronic meaning severe, which that's not what it means. It means long term. So again, all of you that listened and watched me before will know I can be a bit pedantic about that kind of thing. So let's focus on asthma then for a while. So asthma, it can be a very insidious condition. You just like it is in human beings. You can get mild, moderate, and severe cases. So the mild cases, the giveaway often to me is people will come in for something else, like perhaps a routine vaccination, and with a young sort of 2 to 3 year old cat, and just in conversation they'll say, this is the laziest cat in the world. He never does anything. He just lies around all day sleeping, does absolutely nothing, and often in places like the UK, he'll spend a lot of time sleeping in the airing cupboard. I don't know if there are airing cupboards in the rest of the world, but it's where we store all our linen and keep things warm and dry, which and by definition can be a little bit more dusty because there's no ventilation there. So what's going on there is first of all, it's striking. Why is a 2 to 3 year old cat being a slob? That's not necessarily a normal thing. It could be normal for him, but not normal in general. So that would prick my ears straight away, and I'd say, well, hang on, why is this young cat choosing to do nothing? And it probably is a choice, and it's probably that he's got asthma again, which causes inflammation and bronchoconstriction, so narrowing of the airway and increased mucus. So he simply can't exert. If he wants to run around and play and be more active, he just can't get the air in. He just can't move. So it's much easier for him just to do nothing where there's an increased oxygen demand. So it's a bit like if you had asthma, you'd rather sit around than go for a run around the block. And by sitting around and not taxing yourself and not asking the body to do more, you and I, as the pet owner, just would never see that because we're not seeing the cough and the wheeze because they are not exerting themselves to the point where they would trigger that. So if you have a young cat who's really a lazy slob, he may just be that, and if he is, good luck to him or her, because they're set for life. Really, they can just take life easy, chill out while you go to work and earn money to keep them warm and fed. But more likely there could be the asthma. So one would investigate that, and again, you could run all these diagnostic tests and come back with a don't know, can't say for sure it is or isn't. And then oftentimes we would come down to what I would call an empirical treatment trial, meaning that's what I think it is. So let's try some treatment for that, see if it helps you, yes or no. And I'll come back to that treatment in a moment. So more than just the very subtle cases which are sedentary, other cats, people will come in to me saying, I'm really worried. It looks like it sounds like he or she has something stuck in their throat, and they look like they're trying to sort of clear this thing, and they're retching and they're gagging. Well, the first question I would ask in that scenario is, are they still eating or drinking? And the answer is, if they are, then they don't have something stuck in the throat, because clearly you can't eat or drink if you've got something stuck in the throat. And the other thing I would ask is, how long has it been going on? And they'll say often a long time, several weeks to months. And in those cases, I think it would be unlikely that it would be an infection, because that would have either gone away, or bluntly put, you'd be far sicker. And so if you are eating, it means you're not far sicker, and you're not got an obstruction there, and especially if this comes and goes. And so the next question is, I'll say, does this happen like all day, every day, or is it sometimes a day, or is it sporadic? Can it be sort of any time of the day? And mostly people will say either that it's sporadic, it only occurs some days and not others, or they'll say that it occurs sort of a few times a day, but it's not an all-day, everyday thing. And so that again pricks my ears, that you've got something that's sort of flaring up, settling down, flaring up, settling down, the same way that most allergies do. Think of hay fever and asthma as the same sort of thing. It flares and settles and flares and settles. It is livable. I think it's unlikely that it will cause the death of the cat, unless they're exposed to something which really causes a massive bronchoconstriction. So it's just like us human beings as asthmatics. Most of us don't expect to die from asthma, but some people do in the very severe cases. So whichever presentation you have, you would go to the vet, and they would either do the diagnostics, or you can literally, if you're that convinced, let's say it's been going on for 2 or 3 years, it's a sporadic sort of thing, you get that sort of with that very classic posture. I think just Google that, is bound to be on YouTube. Just say videos of asthma coughing cats, and you'll see that very characteristic posture with the head down, head and neck extended, arms out, sort of crouching on the ground. Treatment-wise, steroids, again, are the mainstay of inflammation in the airways, just like they are for us. And in the cases of asthma, one would often want to try a bronchodilator too to break the spasm. And studies have been a little bit sketchy on this subject. We know that the steroids work well for most individuals, and you can administer the steroids one of two ways. Either you can take it in a tablet or injectable form, or you can take it via an asthma inhaler. There are pros and cons, really. Taking the tablet or the injectable is often just much easier because it's in and there you go. The downside of that is long-term it will cause side effects, and it's the classic side effects associated with steroids, which is to say, you'll get an increased thirst and an increased appetite, and because you're eating more, you're going to get fat over time, and it can push up your liver enzymes over time. So it's not desirable from that point of view. The side effects are not catastrophic, but they're certainly not desirable either. So much better to try get it in through an inhaler. So we use literally just the human inhalers, the steroid inhalers, and of course, when you and I take an inhaler, you take sort of a puff and synchronize your inhalation at the same time to get it down into your lungs. Clearly, cats are not going to do that, but they're no different really to young children who have a job synchronizing that. So what you actually get is just a spacer, which is really just a plastic tube, and you put a mask on one end which fits over the cat's mouth. The human ones are sort of teardrop shaped, which don't fit that well on cats. So just look on the internet and you'll get little round ones which will fit just around the cat's nose. You put that on the plastic tube spacer, and you put the inhaler on the other end. So and then what you do is you pump, squirt, get a couple of puffs in the chamber, and then leaving the inhaler in there, you put the chamber over the nose, and you let the cat have 10 breaths. This sounds an impossible task. Most people just roll their eyes when I suggest it, but it's actually a very, very easy thing to train your cat to do. My little Burmese is something of a spitfire, and I've managed to teach her to do it. So the way to start is it all comes apart, just pull the rubbery bit off, put it over the cat's nose, and just let them breathe a few times, get used to it. Then, once they're used to that, over a few days, connect the spacer, let them breathe through that a few times, get them used to it, and then put the inhaler on and puff it, and just take your time. Take a few weeks to train them to the idea. And remember, once you put the puffs in, that chamber has to remain closed at the end with the inhaler, and they have to take 10 breaths from it just to get it in. It's exactly like one would treat a young child who can't synchronize. And that's probably a twice a day thing. Studies have shown that the steroid inhaler works really well. Fluticasone is probably the most common one that we use. And you can use the bronchodilators. Now, interestingly, the bronchodilators alone, and for those of you who are asthmatic, the brown inhaler is usually the steroid inhaler, and the blue one is the bronchodilator. So the brown one is called the preventer, because the steroid stops the inflammation happening in the first place, whereas the blue one is the reliever, and that's when the inflammation has triggered the spasm of the airway. So just using the reliever by itself, the bronchodilator one in cats, seems to have a little to no benefit. But if you use one in combination with the steroid, that does seem to be, in most cases, better than using the steroid by itself. So I tend to go with both, and I use a human product like Pavtide, for example. It comes in various strengths. Speak to your vet about it and try it. So, and that would be a twice a day thing. It sounds like an onerous task, but really it isn't. Once your cat's used to it, it's a minute twice a day, and it can make an enormous difference to their life, and that would be the preferred way. It's only if that doesn't work that we would then use steroids, and you can either, again, give them in tablets or injectables, and you try to use those initially just sort of on an as required basis rather than an everyday forever because of the side effects. And you also have to weigh up, how much is this asthma affecting your cat's life? And sometimes people say, well, they don't seem too bothered by it, but again, cats are masters of hiding their medical conditions. So if there's any doubt in your mind at all about, should I or should I not be medicating my asthmatic cat, then do a trial course, trial it for a while, and you want to trial for about a month. Very often people come back to me after a month and go, I don't think it's made any difference. I think they're much the same. And I'd say, well, okay, let's leave off and see what happens. And then they phone me a week later and go, blimey, the improvement wasn't so obvious, but now that I've stopped giving the treatment, the deterioration back to where they were is strikingly obvious. So that's a nice sort of double check built in for how much we can and should be helping these guys. So I think to sum up, coughing and wheezing in cats, your mind should go to different things that it would go to if it was you coughing and wheezing or the dog coughing and wheezing. Typically, we're looking at lung things. And the the four we described were bronchitis and asthma, which we would treat very much the same, although there are that subtle difference between the two. But if there is an infection or lungworm, that's even better, because that potentially is a cure and it's not a lifelong treatment, whereas the first two probably will be a lifelong treatment. Occasionally also we will get coughing from other causes. People always worry about, could there be cancer, lung cancer? The answer is yes, there could be, but almost always it isn't associated with coughing. And also heart failure in cats can be associated with coughing. Heart failure in cats, again, in people and in dogs, you tend to end up with water logging in your lungs. So remember we spoke about the airways going into the little alveoli, and those tend to sort of get all full of water, and hence you have this sort of moist productive cough, as opposed to the that you see typically in cats. But cats very occasionally, when they have heart failure, will develop a cough. It's not a classic symptom, but it's one to bear in mind. And they cough because they accumulate fluid around the lungs, inside of the chest space. So imagine your chest is just a big cage made of bones, and you've got these two squishy lungs in the middle. If you're accumulating fluid around the lungs, well, there's no stretch in the cage. So what ends up is the lungs end up being compressed, and that has the same effect as the bronchospasm that we spoke about, and that can give your cat that sort of wheezy cough, which is again very different to the human heart failure cough. So the long and the short of it, I think, is if you have a wheezy coughy cat, don't be tempted to say, well, they've always been like that and it doesn't seem to bother them and they're living fine with it, because it's not fine. Speak to anybody who has asthma, mild or severe. They'll tell you it's not a pleasant condition to live with. It does put restrictions and limitations on your life and your exertion, and it's just uncomfortable feeling tight-chested and wheezy. So let's get out there, let's do something for them. Treatments are pretty cheap, pretty quick, pretty easy to do, and it's a matter of also fine-tuning and finding the best one for your cat. So if your cat's doing it and it's something you've been putting off doing, please take them down to the vets, have a chat. You absolutely will transform their lives. Speak to any person you know with asthma and ask them whether they'd want to live with the medications or without, and they will absolutely tell you they want the medications. So thank you again, everyone. Thank you very much for tuning into the channel. I look forward to your comments, and if anyone wants to have me discuss anything in particular, please let me know. All the best. Bye-bye.